Thank you so much. Hello, everybody. I'm Nicole Harding. I am the inclusion manager at the academy that we've already heard about really beautifully from Humera and Henry. I will apologise in advance. I've only joined the NIHR a few months ago, so apologies if there are any questions I can't answer at the end. However, please do ask them, and I'll be really happy to take those away if I need to. So, since we've got that kind of caveated, could I grab the next slide, please? So I'm going to talk about broadly the inclusion side of what across the NIHR, what we do. So inclusion is one of our key operating principles. So we have a really clear commitment to embedding equality, diversity and inclusion in everything that we do. This quotation is taken from our research inclusion strategy, which runs from 2022 to 2027. And that is to fulfil our mission to improve the health and wealth of the nation through research. The NIHR must foster an inclusive environment, engage the talents and energy of diverse people in all areas of our work, and ensure all groups of people are appropriately represented and addressed, both within our research and how we report and distribute our research findings. Could I get the next slide, please? So, in terms of what we're aiming to achieve, when we're talking about our aims, we're looking for inclusion to be embedded across our entire people framework. So our people are in 5 main groups. We've got our NIHR workforce, which is staff in our coordinating centres and research delivery staff. We've got our research workforce, which is made up of people who apply for or are currently in receipt of research funding from the NIHR. We have our advisory workforce, so anybody who sits on committees, reference groups, advisory boards, etc. We've got our research participants, particularly study participants. And then we have across all of those groups our public contributors who they span across all of our other different groups. So we're aiming to deliver inclusion across our whole people framework. We want to embed inclusion within all facets of the NIHR. We want to build momentum for positive change, foster an inclusive environment, engage the talents and energy of diverse people, improve the relevance and quality of our research, and elicit a culture of continuous learning and improvement. Can we get the next slide, please? So, I've talked very briefly about our inclusion strategy. So, like I said, it was published in 2022. It's a 5-year strategy and it's on 5 key themes. Could I get the next slide, please? So our 5 strategic themes, we've got 5 quite broad themes that reflect the fact that we're looking to tackle long-standing systemic and complex issues when it comes to inclusion. So it's not just about the participants involved in research or the populations who benefit, but also who is conducting the research, which feels really relevant today, and who decides what research is funded. So all of our themes need to be evidence-led with opportunities for collaboration, which I'll explain in a second. So our first 3 themes are 1, become a more inclusive funder of research, 2, widen access and participation for greater diversity and inclusion, 3, improve and invest in the talent pipeline, and then our last 2 cut across all of those, which is embedding an evidence-led diversity and inclusion approach and collaborate with partners for impact and sustainability. Could I get the next slide, please? So just to go into these themes a little bit more, with theme 1, our key points under theme 1 are to set and track targets for diversity of professional members on our committees and panels, to pilot inclusive approaches to recruitment and training of those committee and panel members, develop a disability framework, introduce a workforce inclusion survey, develop and put in place across an NIHR training plan for the whole workforce, develop, embed and test the impact of an EIA policy. So some of those things we're already working on. As you appreciate, we're halfway through our strategy life cycle. So broadly, we want to fund more inclusive research, which would be undertaken by more diverse teams who are empowered by more inclusive decisions about who gets our funding. So those are the kind of key points that we want to take away from this one. Could I get the next one, please? So our second theme, we're looking at widening access and participation of greater diversity and inclusion. So this is building very much on theme 1. So putting into place recommendations from our Inclusion in Public Partnerships review, exploring the potential and shape the design of more joined up regional infrastructure to coordinate public partnerships, including building a case for specific resources, applying the lessons being generated by our Race Equality Public Action Group and other partners, to pilot approaches to increase diversity and embed inclusion for public committee panel members, and review and update funding calls and guidance documentation across our global health research. So, as I said, this really builds upon theme 1. So, in order to become a more inclusive funder of research, we need to widen access and participation to make sure that individuals from all backgrounds are able to join and engage with the NIHR. So these are, as I've said, some of the ways that we're going to do that. Could I get the next slide, please? Our third theme is to improve and invest in our talent pipeline. And this is where a lot of the academy work that I'm going to be doing will really support the strategy. So this theme is about exploring relationships with partner organisations to increase diversity and inclusion with lots of different partners. We're going to broaden the reach and scope of our mentoring programme, which is already going really fantastically. We do have a particular focus on people from underrepresented groups. We want to develop and deliver training to mentoring programme leads, and we want to identify potential barriers, develop and test initiatives to attract people from lots of different underrepresented groups to make sure people are coming through to careers in research. We know that people from diverse backgrounds have historically been underrepresented in the whole kind of health and social care talent pipeline, and we're really aware that we need to address this. We want to encourage applications from diverse groups, and we have already introduced positive action statements while we're promoting funded programmes. We have broadened the nomination process for research professors, for example, and this is just us getting started. So, could I get the next slide, please? Thank you. So our fourth theme, like I said, this cuts across all of the other themes. So embedding evidence-led diversity and inclusion approaches. We are working with NIHR employer institutions to improve our coverage, collection and analysis of our diversity data, which we've already seen a huge improvement on over the last couple of years. We're going to create an NIHR standard for diversity data, which will cover data governance, how, when, why we ask for diversity monitoring questions. We're going to expand our data collection, embed a sustainable and consistent approach to the collection of research workforce diversity data, including our infrastructure workforce, develop an analytical method to perform intersectional analysis, because we know that analysing one theme will not be enough. To scope categories to identify the most appropriate way to collect diversity data across global health research, and to initiate and support the collection of diversity data of public contributors as well as our workforce. The fact that we're very evidence-led is really important to us, and we want to make sure that we have impact in the places that really need it. So could I get the final theme, please? So we want to finally collaborate with partners to make sure we have that amount of impact and sustainability that we're looking for. And again, things like our incubators really show us the way about how we collaborate across the landscape. So this might be reaching out to other funders and learning from their approaches, but also working with public contributors and working in collaboration. So a key project that we have undertaken has been the Message Project, which is medical science, sex and gender equity project, which is led by the George Institute, funded by the Wellcome Trust. It brought together researchers, collaborators and patient groups to co-develop best practice recommendations and a sex and gender policy framework for funders and regulators. And we're going to have a really exciting launch event for our own implementation in March. But generally, when we're looking at collaboration, we're looking at establishing those relationships with programs, organisations, where we're looking to increase opportunities and facilitate networking for researchers who are underrepresented, working across the Five Nations Public Partnerships Group to strengthen the UK standards for public involvement. We're looking to co-develop best practice recommendations, like I've said, with the Message Project, and establish an inclusion forum, bringing us and other funders together to discuss equity, diversity and inclusion issues, share data and agree common metrics. Could I get the next slide, please? So very quickly, I appreciate I'm coming up to my time. One example of a key project has been inclusion as a condition of funding. Could I get the next slide, please? Fabulous. So it's building on theme 1, becoming a more inclusive funder of research. We're actually launching in November. We're asking applicants to demonstrate how inclusion is being built into all stages of the research lifecycle, including, but not limited to, the research questions design, the participants recruited, the research methods, data collection, analysis, and the dissemination of findings. This is to make sure that inclusion is being thought of at all stages across the research cycle, and we want to make sure that people feel really confident about doing that. So we have got training for researchers in October, and we have a link in the on our web pages for people to sign up to. I'm going to have to leave it there, I think, because I'm definitely over my time.